Everyone in the child protection system shares the responsibility to ensure the health and safety of every child coming to the attention of the family court, including judges and court staff, caseworkers for the Division of Child Protection and Permanency, law guardians who represent children living in foster care, attorneys representing the Division of Child Protection and Permanency, attorneys representing parents, court volunteers such as child placement review boards and court-appointed special advocates or CASAs, parents and resource parents, and treatment providers. Everyone involved needs to be knowledgeable about early childhood development and use this knowledge to guide their work. By asking the right questions, making sure the right assessments are conducted by qualified professionals, and making sure recommendations from medical professionals are followed, you, regardless of your role in the process, can make a significant impact on the medical, developmental, and emotional needs of infants and toddlers who are under the supervision of the state. We need to be particularly concerned about infants and toddlers for a number of reasons. Infants and toddlers are more likely to fall victim to abuse and neglect, and more likely to die from that maltreatment. That's because very young children cannot take care of themselves, defend themselves, or tell on their abusers. They are unable to recognize danger and to understand what is happening to them. In New Jersey, as is also the case nationally, children under the age of 5 make up the largest group of children receiving services from the Division of Child Protection and Permanency. As of June 30th, 2012, approximately 25% of the children served by the Division of Child Protection and Permanency and approximately 34% of children in foster care were ages 3 or under. Once in foster care, data indicates that infants and toddlers are more likely to remain in placement longer than older children and re-enter the system more frequently. Infants and toddlers come into the child protection system at the most vulnerable and the most opportune time of development. Maltreatment during these formative years often has serious lifelong consequences. From 0 to age 3, a child's brain grows faster than at any time during their lives. Maltreatment during these formative years interferes with healthy brain development, harming intellectual functioning and social and emotional development and well-being. In addition, since an alarming number of these babies are born prenatally exposed to drugs, premature or low birth weight, they are far more likely than other children to have serious medical problems, disabilities, and developmental delays. If left undetected and unaddressed, these health and development challenges can impact their future health and development. Also, for the child's family, many of whom struggle with addiction, serious mental illness, and extreme poverty, the strain of meeting these complex health needs can make it even more difficult to manage the daily challenges of parenting. Research tells us that the impact of maltreatment and possible removal from the home can be lessened if the developmental needs of the infant or toddler are adequately addressed. The care received and attachments made in the first months of life are critical building blocks for future development and adult well-being. The physical, developmental, and mental health status of a child living in foster care should be monitored more frequently than that of children living in stable homes. Scientific knowledge about early child development is available and should be used to make meaningful decisions about placement, visitation, services, and permanency. At ongoing court reviews, the issues regarding what services are needed by the child and family, what services have been implemented, and what steps are needed to ensure the child actually receives the necessary services can be discussed so that the child's well-being and safety are not compromised. The result of these discussions should be reflected in the court order. Several resources are included on the resource list that accompanies this webinar that will provide additional information about the developmental milestones for very young children and services that can address their developmental needs. All states are required to provide comprehensive services and furnish all Medicaid coverable, appropriate, and medically necessary services needed to correct and ameliorate health conditions based on certain federal guidelines. However, while having health insurance entitles an infant living in foster care to health care, it does not guarantee that medical, developmental, and mental health services are actually obtained or obtained in a timely fashion. Every review of a case involving a young child must include questions related to whether the child is meeting his or her developmental milestones, and if not, what action is taken to address the child's delays. In New Jersey, the Division of Child Protection and Permanency requires that comprehensive medical exams are provided within 30 days for all children in placement. Further, Risk assessments, child strength and needs assessments, and caregiver assessments are completed on all children, including infants and toddlers. At the initial 45-day review, judges, caseworkers, law guardians, resource parents, Child Placement Review Board members, and court-appointed special advocates, if appointed, should determine whether the child has received a comprehensive assessment and what were the findings. Questions to ask at the initial review include: what health problems and risks are identified in the infant's birth and medical records? For example, was the child born premature, of low birth weight, or exposed to toxic substances? All indicators that the child may have medical needs that will require intervention. Does the infant have a medical home to receive coordinated, comprehensive, continuous health care? The American Academy of Pediatrics recommends that all children in foster care have a medical home, a place where all of their health care services are provided by a single practitioner who knows them and their caregivers. Has the child received a developmental evaluation by a provider experienced in child development or through the New Jersey Early Intervention System? National data indicates that more than half of children in foster care exhibit developmental delays and disability due to the high number of infants in foster care that were prenatally exposed to drugs and alcohol, born premature and or of low birth weight, and have experienced adverse environmental factors that can interfere with healthy brain development. It is important to be aware of the impact these risk factors can have on motor development, hearing, and vision, as well as growth in language. Is the child and family receiving necessary early intervention services such as speech therapy, occupational therapy, educational interventions, or family support? If so, services should continue while under the care of Child Protection Services. The birth family should be kept informed and engaged in services if possible, so they understand the benefit of the services from the beginning and are involved in the treatment plan for when the child goes home. Are the child's immunizations complete and up to date? Incomplete or delayed immunization suggests that the child is not receiving adequate medical care and is not regularly followed by a provider familiar with the child's health needs. Is fetal alcohol spectrum disorder indicated? Fetal alcohol spectrum disorder is a common medical diagnosis seen in infants in foster care. Because of the large number of children affected by this, there is a separate webinar on fetal alcohol spectrum disorder in this series. Has the child been screened for lead poisoning? Although New Jersey has done much to significantly lessen the number of children who are lead poisoned, there are still many children who have significant levels of lead in their system. Lead poisoning is a dangerous yet preventable illness that can cause learning disabilities, behavioral problems, seizures, comas, and, at very high levels, death. Even low levels of exposure to lead has been found to be associated with decreased hearing, lower intelligence, hyperactivity, attention deficits, and developmental problems that make learning harder. All children by law are required to be screened. Every primary care provider and health care facility that provides care to children less than 6 years of age is required to comply with the law. All children should be screened for lead poisoning at 12 and 24 months of age. Any child who is 6 months of age or older and is exposed to known or suspected lead hazard should also be screened. Has the child received a dental exam? Tooth decay is the leading chronic childhood disease in the United States and is 5 times more common than asthma. All children should see their dentist for an oral exam no later than 1 year of age. If the child does not have a dentist, they should contact their insurance company or HMO. Pediatricians are now being trained to conduct these preventive oral health screens and to apply fluoride varnish. Has the child received a mental health screening as part of the comprehensive medical exam? And did that screening suggest the need for further assessment or evaluation? For infants, every event in their foster care experience, removal, visitation, changes in placement, and reunification, has implications for their healthy emotional development. Sudden and traumatic separation from parents can severely damage a young child's emotional, physical, and cognitive development. Babies grieve when their relationships are disrupted. Resource families and caseworkers should be alert to red flags that may indicate emotional health problems such as chronic sleeping or feeding disturbances, excessive fussiness, incessant crying with little ability to be consoled, or failure to thrive. In addition, it should be noted if the infant has demonstrated attachment to a caregiver. If concerns with attachment and bonding are observed, a formal assessment should be conducted. Judges should ask if an assessment has been conducted and request one if it hasn't. Results can be utilized to guide service delivery and placement decisions. Frequent visitation can help mitigate some of the emotional problems children living in foster care experience. Research shows that children who are visited frequently with parents had fewer behavioral problems and showed less anxiety and depression than those whose visits were infrequent or non-existent. A separate webinar in this series has been created to address visitation needs for infants and toddlers. In addition to gathering information about the child, it is also important to determine if the mother has been screened for and/or diagnosed with maternal depression. If not, it is critical to have the mother screened and to secure the necessary services if depression is indicated. The following entitlements are available to help promote the physical and emotional health of infants in foster care and ensure that they receive the necessary services. Early and periodic screening, diagnosis, and treatment, EPSDT, regulations relating to the delivery of comprehensive health services to all children eligible for Medicaid, which includes all children living in foster care, and the Early Intervention Program for Infants and Toddlers included in Part C of the Individuals with Disabilities Education Act. EPSDT stands for early, assessing and identifying problems early; periodic, checking children's health at periodic age-appropriate intervals; screening, providing physical, mental, developmental, dental, hearing, vision, and other screening tests to detect potential problems; diagnosis, performing diagnostic tests to follow up when a risk is identified; and treatment, control, correct, or reduce health problems found. The goal of EPSDT is to find, diagnose, and treat problems early before they become more serious. Every child should receive one well-child EPSDT exam as a newborn, under 6 weeks, and at ages 2, 4, 6, 9, 12, 15, 18, and 24 months. After 24 months, the child should have one exam a year. EPSDT includes a group of services that are provided free of charge during regular well-child visits. During the visit, the healthcare provider conducts a complete physical exam to check the child's developmental progress and provides lead poisoning screening, vaccines, dental inspections and dental referrals, and vision screens at the recommended intervals. Health education and anticipatory guidance about child development, healthy lifestyles, and accident and disease prevention is also provided. When a screening examination indicates the need for further evaluation of an individual's health, diagnostic services must be provided. Necessary referrals should be made without delay, and there should be follow-up to ensure the child receives a complete diagnostic evaluation. Necessary healthcare services must be made available for treatment of all physical and mental illnesses or conditions discovered in any screening and diagnostic procedure. This includes treatment for defects in hearing, including hearing aids, and treatment for vision defects, including glasses. While all involved in child protection cases should inquire regarding the status of needed evaluations and treatment, caseworkers, law guardians, CASA, and child placement review volunteers, as well as the judge, should be extra vigilant because timing is crucial. Early intervention is the public program that provides supports and services to eligible children birth to age 3 under Part C of the Individuals with Disabilities Act. Early intervention services entitles infants and toddlers who experience developmental disabilities and delays, or who have a physical or mental condition with a high probability of resulting in delay, to an array of services. The Child Abuse Prevention and Treatment Act, or CAPTA, provides that all children who are victims of substantiated child abuse or neglect shall be referred to early intervention services by the Division of Child Protection and Permanency. Nationally, more than half of all infants living in foster care meet eligibility requirements for early intervention services. There is nothing to say New Jersey is any different. The New Jersey Early Intervention Services is under the New Jersey Department of Health, Division of Family and Health Services. Regional Early Intervention Collaboratives are the established regionally based system points of entry for referral to the New Jersey Early Intervention System based on the county of residence. Public and private agencies serve as early intervention program providers and arrange for early intervention practitioners to address the needs of eligible children and their families. Children are screened or evaluated by New Jersey Early Intervention Services, by the Division of Child Protection and Permanency staff, or a combination of the two to determine eligibility. To be eligible for the New Jersey Early Intervention System Part C program, a child must meet the criteria in one of two categories: a developmental delay defined as 1.5 standard deviations below the mean in 2 or more developmental areas, or 2.0 standard deviations below the mean in one area of development. Or the child must have conditions with a high probability of resulting in developmental delays, such as Down syndrome, cerebral palsy, severe attachment disorders, and failure to thrive. In New Jersey, child abuse and neglect is not a presumptive condition for eligibility. Given the high probability that a child living in foster care will require early intervention services, it is important to confirm that adequate screening and evaluations are conducted by qualified professionals to ensure that services can be obtained. If the child is deemed eligible for early intervention services, an individualized family service plan should be developed collaboratively by the birth family, resource family, evaluators, and the early intervention official that can include hearing and vision screening and treatment, occupational, speech, and physical therapy, and special instruction. It is important to note that the early intervention program is an entitlement for both the infant and their parent. It allows caregivers, biological and resource or foster parents, to receive services that can help them enhance the child's development. These services can include parent counseling and training, respite care, and home visitation. In conclusion, the courts are a critical resource for enhancing access to services for infants living in foster care and their families, and ensure the medical, developmental, and emotional needs of infants and toddlers are addressed. All involved in the child protection system, from frontline caseworkers to judges who monitor these cases, need to be knowledgeable of the needs of these children and the tools to protect them from harm. By asking the right questions, making sure the right assessments are conducted by qualified professionals, and making sure recommendations from medical professionals are followed, you can make a significant impact on outcomes for the child and family.